Welcome, everyone. Thanks for joining me today for this webinar. I'm going to be talking about mood issues and how they are influenced by chemical messengers called neurotransmitters. I'm going to first introduce myself so you have an idea of who I am. My name is Dr. Sarv Varta Khalsa, and I'm a naturopathic physician. I've been in practice for about 20 years. And my practice is at Living Wellness Medical Center. And I have here a family practice, and I specialize in women's medicine and hormone balancing, both younger women that maybe are having issues with their menstrual cycle, as well as women that are going through menopause and having a lot of symptoms that are affecting their quality of life. So a lot of hormone balancing, bioidentical hormone replacement therapy, and things like that. I also treat a lot of patients with thyroid issues. So common. I feel like over the past 20 years that I've been in practice, I've seen a real, pretty much exponential increase, I would say, in thyroid issues and conditions, especially Hashimoto's thyroiditis. So that's a little bit about me and my practice. I also really do enjoy helping people that have mood issues. It's such a common problem. And naturopathic medicine has so much to offer to help balance mood and support you in that way without the side effects of having to take medication. So it's really wonderful to be able to help people to feel better. Okay, so I'm going to start off by talking a little bit about depression and anxiety, since those are the kind of mental, emotional conditions that show up very commonly, with mood issues probably the most common. And we are going through clearly a very challenging time in our world, and not just here in our country, but in our world, I would say, with this viral pandemic that we're experiencing. You know I've never experienced anything like this before in my lifetime, and it can be pretty stressful. And I've seen a lot more, of my patients coming in for help with mood issues like depression and anxiety. So there's so much that we can do to support ourselves, even when our conditions and our environmental situations are challenging. So that's what we're going to talk about today. All right, so let's get started. Depression. I'm going to talk about depression, and then I'm going to talk a little bit about anxiety, and then we'll get into kind of the nitty-gritty of the neurotransmitter part of things. Okay, so depression. What is it? We all are, of course, familiar with depression, but I wanted to kind of go over what the typical symptoms are. This is maybe review for many people, and for other people, it might be new and certain things that you didn't realize to look for in terms of symptoms. Depression symptoms can be really mild, and also can be really severe. So there's sort of a spectrum that can occur. So first off, feeling sad or having a low mood or depressed mood, loss of interest or pleasure in activities that you used to enjoy, changes in appetite, whether it's weight loss or weight gain. Everyone's wired a little differently that way. Some people, reach for comfort food and things like that to deal with it. Other people just can't eat. They have no appetite. Trouble sleeping or sleeping too much. So changes in sleep patterns. Fatigue, that's a really common one. And a lot of times, if a person has fatigue, this is always one of the things that you want to consider in your differential diagnosis when you're trying to figure out what is causing the fatigue. Depression should be one of the things that we talk about. An increase in what we call purposeless physical activity. So inability to sit still, maybe you're really restless, pacing, hand wringing, those things happen a lot more, especially with anxiety, but it can happen with depression, or even slowed movements or speech. Feeling worthless or guilty, difficulty thinking, concentrating, or making decisions. That's a common one. Thoughts of death or suicide, especially, of course, in severe cases of depression. So those are, of course, things that I always ask my patients when they come in seeking treatment for depression. Are you having thoughts of suicide? If so, have you ever thought about it in terms of formulating a plan, or, how you have to determine if it's a real risk or not. And if so, take the steps to help that person with that. So for depression to be official depression, symptoms must be last at least 2 weeks, represent a change from your previous level of functioning. We all can feel depressed about things that are happening in our lives, situational things. And so really part of how we determine if this is, something very temporary and situational, or is this a long-term issue that really needs to be addressed and maybe investigated by looking at neurotransmitters and things like that. This helps to kind of determine that, how long you've had the symptoms for. So how common is depression? In my clinical experience, depression is extremely common. It's one of the things that we always ask about with our initial intake. And many of my patients will kind of mark that off as something that they struggle with, whether it's present or in the past. And so it's very common. So depression affects an estimated 1 in 15 adults in any given year, about a 6.7%, probably higher than that, but 1 in 6 people will experience depression at some point in their life. It typically appears earlier, like in late teens to mid-20s, but it certainly can develop at any point in a person's life. Women are more likely than men to experience depression. And studies show that 1/3 of women will experience a major depressive episode in their lifetime. That's really high. 1 in 3 people that will have a major depressive episode. So it's, really pretty common. There's also a high degree of heritability. So genetically inherited, approximately 40% when a first-degree relative, like your parent, one of your parents or both, your children, siblings have depression, your chances of also struggling with depression really increases. So we see that a lot running in families. And there are different reasons for that. So what are some causes of depression? First off, biochemistry. That's what we're talking about today, an imbalance in certain chemical messengers or neurotransmitters in the brain that may contribute to symptoms of depression. So I'll be talking a lot more about that in just a little bit. Nutrition and lifestyle, of course, is really important. Nutritional deficiencies like B vitamins, magnesium, many other things. I'll get into kind of the nitty-gritty details of that when we talk about neurotransmitters. Lack of exercise, inadequate sleep. These are all things that can contribute to depression or, they can cause you to have low mood, especially if you have a tendency toward that anyway. Genetics. Depression, once again, as I said, can run in families. We see that a lot. So one identical twin has depression. The other twin, their twin, has a 70% chance of also having depression. So once again, that's genetics play a pretty significant role with mood, determining your mood and depression and anxiety. Personality, we're all wired a little bit differently. Part of that I think also is genetic, part of it is environmental, experiences that we had growing up and things like that. But people with low self-esteem, who are easily overwhelmed by stress, or who are generally kind of pessimistic in their attitude toward life, appear to be more likely to experience depression. And that kind of makes sense. Those things go hand in hand. Can be environmental factors. So continuous exposure to violence, neglect, especially as a child, abuse, or poverty can, of course, make somebody more vulnerable to depression. And, once again, especially growing up as a child in an unsafe environment is a huge risk factor for struggling with lifelong depression, anxiety. Treatments. So treatments for depression might include balancing and supporting neurotransmitters. And we do that primarily with specific nutrients and supplements, which I'll talk about. Supporting, of course, healthy habits like healthy diet, exercise, getting adequate sleep. All those things help a lot. Counseling and psychotherapy can definitely be very helpful. Self-help activities like improving your coping skills. We all have stress. We all have things that happen in our lives that are challenging. And how you deal with those things is really important. So they have the saying, right? It's not what happens to you, but how you deal with it. Changing your point of view. Maybe making more of an effort to focus on the positive things in your life and not be so pessimistic and things like that. It can really have a significant impact on your mood. Of course, medication is always an option. As naturopathic physicians, we are, of course, always trying to use the least invasive, most supportive things for the body to address health concerns, including depression and anxiety. And we are often very successful in treating things with those natural therapies. But there is a time and a place for medication. And there are some people that will do best being on a medication, and especially in severe cases of depression or anxiety. And we can often use them together as well. They're not mutually exclusive of each other. Homeopathy. I love using homeopathy in the treatment of anxiety and depression. I've had really fabulous results using these medicines. Also treating any MTHFR genetic mutation that might be a part of that person's picture. And so I actually did a webinar on this a few months ago. So you can actually access that through our website and watch that. But it's basically a genetic mutation that can occur that primarily affects your body's ability to produce the active form of folate, folate is extremely important in modulating mood. And when you're deficient in folate, you can develop depression, anxiety, among other health issues. So that's something that I will test for when it seems appropriate. Okay. Anxiety. So anxiety disorders are the most common mental disorders, even more than depression. So many people struggle with anxiety. It affects nearly 30% of adults at some point in their lives. And so anxiety refers to the anticipation of a future concern, worrying, anxious, and is often associated with muscle tension, avoidance behavior, especially if it's, something you're feeling anxious about and you don't really want to do. Avoidance behavior is very common. And of course, it can have very specific physical effects in your body, things that you feel in your body when you are anxious. To be diagnosed with an anxiety disorder, the fear or anxiety must be out of proportion to the situation or age inappropriate. And it also hinder your ability to function normally. So, and when I'm talking about anxiety disorder, that is a specific diagnosis. You can have anxiety, just sort of run-of-the-mill anxiety, which I don't think there's probably any human on the planet that hasn't experienced some anxiety. That, is a little bit different from an official diagnosed anxiety disorder. And there are different types of anxiety disorders. There's generalized anxiety disorder, probably the most common. Oh, actually, we're going to talk about prevalence on the next slide. So generalized anxiety disorder, panic disorder, specific phobias, and actually I think that is listed as the most common, believe it or not. we all have different phobias, right? Things we're afraid of. Agoraphobia, so fear of leaving your home. Social anxiety disorder, which is super common, and separation anxiety disorder, especially in children. So how common is it? In any given year, the estimated percent of United States adults with various anxiety disorders are specific phobias, 8 to 12%, social anxiety disorder, 7%, panic disorder, 2 to 3%, agoraphobia, 1 to 2.9% in adolescents and adults, generalized anxiety disorder, 2%. I'm actually surprised that's not higher. Separation anxiety disorder, 0.9 to 1.9%. And women are more likely than men to experience anxiety disorders, and similar with depression. You know, part of that could be influenced by hormones. Hormones are extremely important in affecting how we feel, and you can certainly have a worsening of anxiety or depression around the time of your menstrual cycle, around the time of menopause, and things like that with those hormonal changes. So perhaps that hormone connection is one of the reasons why women are affected a little bit more than men. You know, once again, I'll just comment that, you know, I think these numbers are a little bit, probably a little lower than in actuality. And, you know, part of that is that, you know, these statistics are based on people that maybe went to a doctor. You know, they are seeking help for themselves. Not everybody does. You know, many people struggle with anxiety and depression, and they don't see a doctor. They don't maybe have the resources, or don't even realize that they should or could seek help for themselves. So probably these percentages are quite a bit higher in the real world. Okay, causes of anxiety. Once again, genetics. I mean, it's really similar in the same ones as we just talked about with depression. Anxiety, genetics. So anxiety disorders can run in families. And it, you know, really it's a combination of genes and environmental stresses that can produce the disorders. So it's a combination very often. Environmental, growing up in an unsafe or unpredictable environment. You know, children do well with structure. And, you know, when things are really unpredictable, they never know what to expect, or they have a parent that is abusive or lashes out or things like that, or maybe an alcoholic with unpredictable behavior, that is really laying the groundwork potentially for a lot of issues with anxiety and depression. Psychological, depression is a risk factor for developing anxiety. And so they often coexist, and I see this all the time in my practice. And so sometimes when you treat one, the other gets better, and vice versa. And a lot of times we're treating both, you know, and we might be treating and supporting things in different ways. Nutritional, so of course a poor diet or malabsorption of nutrients can lead to nutritional deficiencies, can lead to blood sugar dysregulation. Certainly, you know, low blood sugar can be a trigger for anxiety in some people. And then, of course, a chemical imbalance with your neurotransmitters, which we'll talk about. MTHFR genetic mutation can also be a cause of anxiety, an underlying factor. Treatments, balance and support neurotransmitters, support healthy habits, all the same ones that we talked about with depression, counseling, psychotherapy, self-help activities, medication, homeopathy, treat any MTHFR genetic mutation. So neurotransmitters, let's talk about what they are. So they are endogenous chemicals, meaning chemicals that are produced in our body that allow neurons or nerve cells to communicate with each other throughout the body. And so when a nerve cell is activated, neurotransmitters are released into the synapse, which is the space between the nerve cells, from specialized pouches that are clustered near the cell membrane. They're called synaptic vesicles. And then there are specific receptors on the neighboring nerve cell that can take up those neurotransmitters. And when those neurotransmitters attach to those receptors, it has an effect in that neighboring cell. It can either increase or decrease the signal being passed along that particular circuit. And so some neurotransmitters are what we call excitatory. They're kind of uppers, so to speak, and some are inhibitory, and more downers. And the brain needs neurotransmitters to regulate many different things in our body, including heart rate, breathing, your sleep cycle, digestion, your mood, concentration, appetite, and muscle movement. So lots of different things in the body are affected by these neurotransmitters. And here are the different types. There are more than this, a few more, but I just wanted to focus on the main ones. And so here's a list. So you can see here, some are listed as inhibitory, some are excitatory. And so I'm just going to kind of go through. So serotonin, probably most people have heard of serotonin, and that's an inhibitory neurotransmitter. Dopamine is inhibitory. GABA is the main inhibitory neurotransmitter, the most powerful. Glycine is inhibitory. And then we have our excitatory neurotransmitters. So epinephrine, norepinephrine, glutamate, PEA, and histamine. So I'm going to go through each of those neurotransmitters, talk about the effect that they have in the body, and also what happens when that particular neurotransmitter is too high or too low, and what treatments we can utilize to help balance that neurotransmitter out, depending on what's going on. So serotonin, it's often referred to as the calming chemical or the happy neurotransmitter, and it's best known for its mood modulating effects. So it's really, really impactful when you have low serotonin. It can lead to depression, and often does. A lack of serotonin linked to depression also has been implicated in helping to manage appetite, sleep, memory, and decision-making behaviors. And so, these are other things, other ways that I will sometimes utilize, or other conditions that supporting serotonin might help with. So for example, managing appetite. Sometimes, when serotonin levels are low, you can have more cravings and sugar cravings and things like that. So sometimes we'll support serotonin levels and those behaviors will improve. And also similar with sleep, supporting serotonin can help with sleep as well. Okay, so when levels are too high, there really aren't specific symptoms outside of possible serotonin syndrome. And serotonin syndrome is a condition where serotonin levels are too high, and it actually, if it gets severe enough, is a life-threatening condition. So it definitely needs to be addressed. It's extremely rare. In my 20 years of practice, I've never seen it. I've never had any of my patients experience that. When it typically occurs is when a person is taking more than one medication, for depression, especially the SSRIs, the selective serotonin reuptake inhibitors. There are that can occur sometimes. There needs to be awareness about serotonin syndrome when you're maybe taking a medication and supplementing also to support serotonin levels. And I will, if I'm doing that with a particular patient, I will always let them know about serotonin syndrome and sort of educate them on what to look for, so that in the event that they have those symptoms, of course, they can immediately stop the treatment and, of course, contact me right away, stop the treatment, And, the good news is that that resolves the symptoms when you stop the treatment. And then, of course, we need to reformulate a plan of how to move forward. So that can be, there are different symptoms, but the main ones I'll just kind of rattle off here. Increased body temperature. So basically having a fever, it can be as high as like 104. So it raises your body temperature. Agitation and restlessness, muscle rigidity, headaches, tremor, nausea, vomiting, diarrhea. So pretty severe symptoms, though. You would know that you're sick and something is going on. So that's when levels are too high. When levels are too low, you can experience low mood, insomnia, uncontrolled appetite, or sometimes sugar cravings, headaches, and hot flashes. So what can we do about it? So when levels are too high, things that can kind of help to lower your serotonin, L-theanine, which is an amino acid. It is extracted from green tea. And I use L-theanine a lot also to treat anxiety, and I'll talk about that. But it can also help kind of decrease serotonin if it's too high, which I would imagine is pretty rare. So much more common for it to be low. Rhodiola, which is an adaptogenic herb. SAMe, which is a chemical that is naturally produced in our body, that's produced from methionine, which is an amino acid. And sometimes when your SAMe levels are low, boosting them up with supplementing can be helpful. Vitamin B2, which is riboflavin, vitamin B3, which is niacin, and iron. Iron is something that I like to test for, and I include that in kind of my screening tests with labs when I'm testing labs for a patient, especially at their initial appointment. I like to do an iron panel with ferritin just to see if it's a factor. It's, much less likely for men or women that are postmenopausal to have issues with iron levels, but sometimes they do. And it's very common actually for women that are still menstruating and losing blood every month and therefore losing iron. Really important to check iron levels. When levels are too low, things that can be helpful, L-tryptophan, which once again is an amino acid and is a precursor to serotonin. It's a building block or precursor. 5-hydroxytryptophan. Tryptophan gets converted into 5-hydroxytryptophan, which then converts into serotonin and then melatonin. So L-tryptophan and 5-HTP are both really helpful. I will use L-tryptophan, especially in a patient that's having also issues with sleep. L-tryptophan also really is a great treatment for insomnia, but it can also help mood. And then I also use 5-HTP. I probably use 5-HTP more commonly. And once again, that's a precursor to serotonin. L-theanine can be helpful. Once again, rhodiola, vitamin B6, vitamin B3, which once again is niacin, vitamin C, zinc, and SAMe. I'm not including specific dosages with this webinar because treatment is very individualized and it can vary a lot depending on the person, where your neurotransmitter levels are, if we've done some testing to see where your levels are, and things like that. And also maybe a little bit of history, what have you tried before, and things like that can influence the individualized treatment plan that is best for you. So let's move on to dopamine. So dopamine is referred to as the pleasure chemical. And so it's released when you receive a reward in response to your behavior. And so dopamine's released during pleasurable activities like eating delicious food, drugs, sex. Dopamine is released during those activities. So it kind of makes sense with some of the addictive issues that can occur around these things people are looking for that dopamine release, that dopamine rush, because you experience pleasure when dopamine is released. So unfortunately, with drug addictions and stuff, it actually ends up depleting your dopamine, and so there's this constant reaching for that high or that that pleasure that they initially experience. Okay, dopamine is also very important for memory, learning, behavior, and movement coordination. And so it's important with muscle movement. And so a deficiency of dopamine can lead to Parkinson's disease. And so one of the treatments for Parkinson's is supplementing with dopamine, or with the medication that helps increase dopamine. And on the other end of the spectrum, I didn't put it on the slide, but on the other end of the spectrum, when you have too much dopamine, that is actually the case with people that have Tourette's syndrome. And so with those people, you are actually wanting to decrease dopamine levels rather than boost it up. A healthy diet helps balance dopamine levels. And like with everything, it helps just in general with balancing neurotransmitters, but specifically amino acids, which are the building blocks of protein. So protein is really important. Making sure you're eating adequate protein helps to produce dopamine. So that's always something you want to pay attention to if you make any, especially drastic dietary changes, maybe moving toward a vegan diet or something like that, or even a vegetarian diet where you may or may not be getting enough protein in your diet. And that's something to really pay attention to make sure that you don't notice any mood changes when you change your diet. Exercise, of course, helps to boost dopamine levels naturally. Eating high amounts of saturated fat can lead to lower dopamine activity. And a deficiency in vitamin D can also lead to low dopamine activity. So when levels of dopamine are too high, you can have attention issues. And this includes ADD and ADHD in children. So I'll sometimes do neurotransmitter testing in children that come in with these concerns and these challenges. Developmental delays, once again, in children, poor intestinal function can happen. And then when levels are too low, addictions and cravings. Those are the main things that we see. So to help kind of curb dopamine levels and bring things down if they're too high, we can use L-theanine, rhodiola, and you'll see these treatments, they come up with a lot of the different neurotransmitters. And in some ways, that's a good thing, because you can use, one or two or three things to really create good balance with your neurotransmitters. And of course, with that, your mood will greatly improve. So L-theanine, rhodiola, vitamin B6, B2, vitamin B3, vitamin C, zinc, SAMe, and iron. And treatments, if levels are too low, L-tyrosine, which is a precursor or building block to dopamine, L-theanine, rhodiola. So you can use those treatments whether it's too high or too low. So those are considered what we call modulators. They can bring things down or up depending on what your body needs. Mucuna pruriens. This is actually a bean that's grown in the tropics, certain areas of Asia and Africa. And it has shown to help regulate and balance neurotransmitters, especially dopamine and some others. It's also touted as being like a nice treatment for an effective treatment, sometimes for men's health issues, sexual health issues like erectile dysfunction. It's thought to increase testosterone levels. So it can be used in other ways, but one of the benefits is that it increases dopamine. Vitamin B6, B3, folate, and you'll see, kind of that theme once again in terms of the treatments. The B vitamins in general are so, so important for regulating and balancing mood. Vitamin C, zinc, SAMe, once again, iron, and vitamin D. Because remember, a deficiency can affect activity of dopamine activity. GABA. GABA is the most inhibitory neurotransmitter, so it's very calming. GABA works to inhibit the neural signaling. So it's a downer. It calms everything down with your mind as well as your body, but especially your brain. So it also plays an important role in brain development. New research shows that GABA helps lay down important brain circuits in early development. So you can imagine, if GABA levels are too low, once again, especially in childhood and those developmental years, it can really have a tremendous impact. GABA is also, it's been nicknamed the learning chemical. And studies have found a link between the levels of GABA in the brain and whether or not learning is successful. So this is probably one of the reasons why supplementing with GABA or precursors to GABA, things that influence GABA, we call them GABA agonists. So things like L-theanine are wonderful at calming the mind, but increasing cognitive functioning and sort of your thinking abilities. And so that's really kind of a perfect combination when you're wanting to kind of maybe calm down anxiety that you're feeling, but have a sharp mind. L-theanine is perfect for that. And so before taking a test or, public speaking or something like that, it's a wonderful thing to take, and it can be very helpful. Also, just going back real quick, you can actually supplement specifically with GABA, and actually that's really on the next slide, and that can be really helpful as well. So when levels of GABA are too high, you can have anxiety, insomnia, hyperactivity. And interestingly, when levels are too low, you have the same symptoms, but more severe. And I would say low GABA is much more common than high GABA. And so anxiety is probably the most common thing that we see. But also certainly it can contribute to sleep issues and hyperactivity. So when levels are too high, you can use L-theanine. That's a GABA agonist. When levels are too low, you can also use L-theanine, and you can use GABA itself. A supplement that I recommend a lot to my patients is Pharma-GABA, which is a chewable form of GABA. It's an absorbable, highly absorbable form of GABA. I use it myself. It works really, really well. Just pop a couple tablets. They're chewable. Pop a couple tablets in your mouth, chew them up. And within 10, 15 minutes, typically, you feel better, more calm. It's really helpful also for sleep. Taurine, glutamine, and vitamin B6 are also treatments that can boost up GABA. And so sometimes those will be included maybe in a combination formula that helps support GABA as well. Glycine is an inhibitory neurotransmitter. It's calming like GABA, and it calms and relaxes the body and mind. So when levels are too high, you can experience anxiety and low mood. And when they're too low, there aren't specific symptoms associated with this. And we're talking a little bit more about testing, if levels are too high or too low with actual neurotransmitter testing. And so glycine is actually a wonderful treatment that can be utilized for anxiety, and it's very effective. It typically comes as a powder or a capsule, but it's nice as a powder because you can just mix it in water, a little bit of water, drink it, and once again, have a pretty immediate effect, calming effect from taking the glycine. So that's another treatment that I utilize often for anxiety. And I would say everyone is a little bit different. Once again, we are all individual. We're wired differently. environment, genetics, everything. And so some people maybe do best with L-theanine, some people with GABA, other people do best with glycine. And so, sometimes we'll use them in combination. Sometimes we'll try one and maybe move to the other, and try different things to see what works best for that individual person. Okay, so those were all of the inhibitory neurotransmitters, and now we're going to talk about the excitatory ones. Epinephrine, also known as adrenaline, and it's secreted by the adrenal glands, and it's involved in the body's fight or flight response. And so when you're stressed or scared, your body releases epinephrine, and that has specific effects in your body as that fight or flight feeling. And so it increases your heart rate and your breathing, increases blood flow to your skeletal muscles, which will allow you to either fight or run because your muscles need that blood and that oxygen to function. It helps the brain make quick decisions in the face of danger. It actually has the effect of breaking down stored glucose in the form of glycogen in the liver. The liver actually stores glucose or sugar and can break it down. The epinephrine breaks it down and allows that sugar to be used by the brain in these situations where you're facing danger. So, of course, it's useful when you're threatened, but when this is released with chronic stress and you're just maybe sitting at your desk at your office and having stress, it's not always that helpful. And especially if you have too much epinephrine released over time, for a long period of time, it can lead to health issues. So decreased immunity, high blood pressure, diabetes, heart disease, things like that. But on the positive side, it's also very helpful. It's important in motivation, energy, mental focus, things that can help kind of support the adrenal glands and curb the release of epinephrine. Meditation, deep breathing, and exercise are all very helpful. And then here's the nutritional part of it. So levels too high, you can experience anxiety, insomnia, attention issues. Levels too low, you can feel tired, so fatigue, lack of focus, difficult weight loss. So when levels are too high, treatments that can be utilized, L-theanine, once again, rhodiola, vitamin B2 and B3, and iron and SAMe, all the same stuff. When levels are too low, L-tyrosine, which once again is a building block. So L-tyrosine converts to dopamine, that converts to norepinephrine and then epinephrine. So L-theanine, rhodiola, mucuna, vitamin C, vitamin B6, magnesium, iron, SAMe, and of course adrenal support, because epinephrine, remember, is released by the adrenal glands. Norepinephrine. Norepinephrine converts to epinephrine. So norepinephrine is both a hormone and a neurotransmitter, and it's been linked to mood, arousal, vigilance, memory, and stress. So it's very important for mental focus and emotional stability. And norepinephrine converts into epinephrine. So L-tyrosine to dopamine to norepinephrine to epinephrine. And newer research has focused on its role in PTSD and Parkinson's disease. So if levels are too high, you can have anxiety, stress, hyperactivity, high blood pressure. It constricts blood vessels, similar to epinephrine. When levels are too low, you can have low energy, lack of focus, lack of motivation, and low mood, similar to epinephrine. They're kind of like sisters. They're similar. Treatments for when it's too high, L-theanine, rhodiola, vitamin B2, B3, iron, SAMe, and adrenal support. When it's too low, L-tyrosine, L-theanine, rhodiola, mucuna, vitamin B6, vitamin C, and once again, adrenal support. So remember, cortisol, which is your stress hormone, is also secreted by your adrenal glands during times of stress. And that's sort of the hormonal piece. These are the neurotransmitters. So your adrenal glands have a part of it's controlled by your nervous system, or part of your nervous system, and part of it's part of your endocrine system or your hormones. Glutamate is the most excitatory neurotransmitter. So too much glutamate can actually be toxic to your cells, excitotoxic. And so it can actually cause nerve cells to die. And this typically occurs with stroke or traumatic brain injury or ALS, which also called Lou Gehrig's disease, a progressive debilitating neurodegenerative disorder. And so that's part of what's happening and causing the nerve cells to die with ALS is too much glutamate. And I guess the question is, the chicken or the egg kind of situation. Is it too much glutamate for some reason that's causing them to die, or is it the disease process itself that's increasing glutamate? But in studies, we found that this is a factor. It's important in learning and memory, and with something called long-term potentiation, which is the molecular process that's believed to help form memories. So when levels are too high, you can have anxiety. It's excitatory. You can also have low mood or seizures. When levels are too low, you can have fatigue or poor brain activity. So for too high, you can use L-theanine, taurine, and NAC, which is N-acetylcysteine, vitamin B3, B6, or magnesium. And then if levels are too low, you can supplement with glutamine. Glutamine is an amino acid, and it's a precursor to glutamate. PEA is also an excitatory neurotransmitter. It's important for focus and concentration. So if levels are too high, you can have anxiety, insomnia, racing mind. When levels are too low, you can have attention issues, difficulty thinking clearly, and low mood. So if it's too high, you can use probiotics, decrease protein. Sometimes that can be a factor, and decrease also fermented foods. When levels are too low, you can supplement with DL-phenylalanine, kind of a building block once again. You can supplement with PEA itself or probiotics and vitamin B6. Histamine. Histamine is also an excitatory neurotransmitter. It helps control the wake-sleep cycle. It's important in regulating energy and motivation. And of course, histamine, we know, is released with allergies or allergic reactions. So when levels are too high, you can have insomnia, allergic responses. If levels are too low, you can have fatigue. And so that's part of what's happening when you have allergies and you take maybe an antihistamine medication like Benadryl. It's lowering histamine levels so much that you actually feel tired. So treatments, when it's too high, you can avoid histamine-rich foods. Those are things like alcohol, aged cheeses, fermented foods, including kombucha, things like that. It's also in lots of fruits and vegetables. So going on a low histamine diet can be helpful for people that struggle with that, but it can be difficult. It's challenging as well. There are also supplements that you can take. So diamine oxidase, or DAO, actually helps decrease histamine in the gut. And then anti-inflammatory compounds like quercetin, curcumin, boswellia, different flavonoids. Also MSM, vitamin B2, B6, and SAMe. And once again, it's not like you have to take all of these things when you have issues necessarily. You really want to have an individualized treatment plan developed by the health practitioner that you're seeing, or naturopathic physician, or whoever it is that you're seeing. And when levels are too low, the treatments are histidine, vitamin B6, SAMe. These are all helpful. So that is all the different neurotransmitters that affect our mood. So how do you test for them? We test them with a urine test. It's a kit that's typically provided by your doctor. Here at Living Wellness Medical Center, we use Labrix or doctor's data. I typically do the NeuroBasic profile most commonly, and people always ask about the price of things, so I just put it down there. It's $275 for that panel. And there's also a comprehensive panel, which we'll do sometimes if it seems appropriate. But the NeuroBasic panel includes all of the neurotransmitters that we just talked about. And the results typically return in a couple weeks. And then we go over the results, and this is what they look like. I know this is really small on your slide, but basically on the left there is just a list of the different neurotransmitters, and then it lets us know, which ones are low. Is it within normal range? Is it too high? And then based on that, we formulate an individualized plan to help balance things out. So in conclusion, as you can see, neurotransmitters are very important in regulating our mood. Symptoms can occur if your levels are too high or too low. So it's important to balance them out. It's very easy to test for. It doesn't even require a blood draw. You just collect some urine. Treatment is to supplement with specific nutrients, and also, of course, supporting healthy lifestyle choices. And individualized treatment provides the best results. All right, so that is the end of my webinar for today. I hope you all learned a little bit. And if you are someone that struggles with mood issues, whether it's depression, anxiety, or you know someone does, feel free to give me a call. Here's my information here on this last slide. You can schedule an appointment with me. I also offer a free sort of meet and greet, a 15-minute phone appointment where you can fill me in on what's going on, and we can make sure that it's a good fit for what you're looking for. And all of the doctors here at Living Wellness Medical Center, almost all, offer a free meet and greet. So I'm always happy to do that for anyone that's interested. Okay, I am going to, at this point, open it up for questions. I'm going to kind of look through the chat and see if there are specific questions that I can answer for you. Okay, let's see. Yeah, and I apologize if there were some technical difficulties through this webinar. It seems like, at different times people could hear me but not see me, and vice versa. So anyway, I apologize about that. Great, you're welcome. All right. It looks like there are not any specific questions. If you think of anything later on, feel free to reach out. Once again, my information is here on the slide. And feel free to visit our website if you want to learn more about our practice here at Living Wellness Medical Center, or me as a physician. You can read more about me with my bio that's on our website. Also, feel free to follow us on Facebook, which is, of course, Living Wellness Medical Center. We have a Facebook page with lots of great posts and information. So yeah, thank you so much. Thank you, everyone, for joining me today for this webinar. And definitely tune in for future webinars, because we're doing them frequently. And hopefully we will see you for the next one. All right. Have a great weekend. Thanks. Thanks, everyone. Bye-bye.